subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We are delighted to have you with us today. When we plan out our Seniors Today sessions, we look at various ailments that are there that people like to know more about. We also talk about ailments that we receive requests from. And we also look at, of course, what is happening around in the world around us, and which is where we decided that we must look at doing something around the summer. Now, the summer hasn't set in right earnest, and which is perhaps why it's a good idea that we look at how we should brace ourselves for the summers, and which is why we have a session today on health risks and care in summers. And for this, we've invited Dr. Rajkumar. Dr. Rajkumar is a senior internal medicine specialist and a consultant at the Indian Spinal Injuries Center in New Delhi. He has worked with the Fortis Hospital, until recently or some years back. And I know this is not an area of specialization, which is summer care, but being an internal medicine specialist, he was perhaps best suited to speak with us on that. How are you today, Dr. Rajkumar?
Good evening, sir. I am fine. How are you?
I'm good. Thank you. So, this is a very unusual topic that we are looking at, which is summer. But fact of the matter is that summer is where it's a great season to be in. It's sunny times, etc. But it's also a very unhealthy season, right? It is a very unhealthy season. Tell me, sir, which, according to you, which is a more unhealthy season? Is the summer a bigger problem or the winter a bigger problem?
Sir, both have its own this thing. But I feel that summer is more because in elderly age, summer season is little more harmful as compared to the winter season. In summer season, we have other illnesses like patient in elderly age group. They are more prone to be for heat stroke and all those things related to heat. And in winters, we have more of respiratory illnesses. So both are little harmful. Like in winter, we have more pollution. But in summer, focus is more on the how to protect the elderly age group, people in the elderly age group from the heat stroke and other things related to heat.
That is an unfortunate reality of the, and what's also happened, doctor, is that you spoke about respiratory ailments being, weather related in the winters, but with all sorts of construction happening in our big cities and even in our small cities, tier 2, tier 1 cities, flyovers being built and, a lot of civil construction, a lot of redevelopment. There is AQI levels were earlier only a problem of the city that you are in, which is Delhi. But now AQI levels in Mumbai also are fairly bad. So, doctor, let me ask you a question, before I invite people to send their questions to Dr. Rajkumar, who is going to talk to us about summer health, the care that you need to take, the risks that are involved, and what you should do. And I will request him to make a few opening remarks. But before that, doctor, I want to ask you this question as to, would you say, and you have a length of experience in medicine, and you've been practicing as an internal medicine specialist for some years. Have the problems increased over in the recent past? Is there a greater concern now, or was it even a concern earlier?
About the health of the elderly, you are saying, right?
About the health of the elderly, especially in the summer.
Yes. One more thing I want to highlight here that, see, we are talking about the pollution, right? So pollution we know more in the winters, but the pollution is little more in the summer also, because our air gets stagnated with the hot and humid environment. Our air gets stagnated. So what happens? The air pollutant that that are emitted by the vehicular and the burning fuels by the community. So what happened? The sunlight had a reaction with all the pollutant and it created ozone layer. So what we are talking in the summer about the pollution, it is more of the ozone thing. The quantity of the ozone is in air is little more. So actually the pollution in the summer is little more harmful as compared to the winters. Yes, of course, in winters we have other issues because the AQI index in our country is little more in winters, but still in summers the pollution level is still more high.
Doctor, let me request you to make a few opening remarks about the topic that we have, which is healthcare and risks for seniors in the summers. And after you make your opening remarks, what I'm going to do is I'm going to request people that take full advantage of the fact that we have Dr. Rajkumar in the house, and you can ask him all the possible questions that you have. Just remember, when you're asking the question, do mention your age and your gender so that Dr. Rajkumar could give you a better, a more considered response. Over to you, doctor.
What we are talking about is the health of the elderly age group in summer. So they are more prone to get dehydrated. That is because the skin in the elderly age group, the water content of the body is little low as compared to the adult population, and the skin changes in the body, like they cannot adjust to the temperature variation as the adult do. So, and the other thing is they are suffering from chronic illnesses like liver disease, kidney disease, heart disease. So that make them more prone to get dehydrated and more prone to be heat related illness. Like summers are coming in next 1 or 2 months. So the temperature will go up to 40, 43. So they are very more prone to have heat cramps, heat related illnesses and heat stroke. Now, what are the symptoms of heat related illnesses? Like they are more prone to get dehydrated. So they may have symptoms of nausea and vomiting, faintness, dizziness. And if they get dehydrated, they will have symptoms like low urine and more concentrated urine. So we usually advise them to keep them well dehydrated and avoid going outdoor in community if possible, and keep themselves indoor and in a ventilated and a good like inside a AC room or a cooler room. So that is how we can prevent them from getting exposed to the heat. And second thing, we tell them to get very well dehydrated, take adequate amount of fluid, and keep on taking adequate amount of fluid throughout the day. Like the normal intake that is advised for them is to keep them to take around 1.5 liter of fluid in a day. And the other thing also, as they are suffering from many chronic illnesses like diabetes, and they are taking antihypertensive, their BP medication, especially to mention the diuretic. So that thing also put them at risk of having acquiring the heat related illnesses.
All right. Thank you, doctor, for your opening remarks. I would like our people to ask us questions. So the first one which has come in is from Mr. Brij Jugal, who's one of our regular attendees. And his question is, water is an important input to the human body. How much and what is the methodology to be followed during the summers for senior citizens?
Yes, sir. As I already told you, that keep the most important thing to keep the intake of water inside the body properly, right? And avoid exposure to sunlight. Like we know, the heat is maximum during the midday. So avoid going outside if it is possible. If they can avoid it, avoid going outside in the midday time, and keep the activity during early morning or late in the evening, right? And keep themselves dehydrated, and eat fruits and like vegetable, and the fruit and the vegetable which are high in water content, like cucumber we can eat, like watermelon, tomatoes. These are the vegetable which has a high content of water. So keep them taking at frequent interval with lot of fluid, and keep themselves not getting dehydrated. If they have any symptoms of heat related illness, then they should increase the fluid intake of their body by taking lot of fluid like they can take frequent ORS or juices or coconut water.
One of the questions which people will have is while in fact that's another question that I've just got on the WhatsApp, is that while water is good to have, but if people who at the senior age it has been generally recommended that one should not have too much of water because it could lead to problems, especially with those who have higher sugar levels.
So for higher sugar levels, you at least you need, see, body's requirement is minimum amount of fluid you have to take. Like those who are suffering from heart disease or kidney disease, we advise them not to take too much of fluid, but at least during summer, as the requirement of body is little high, as because of that high temperature, the requirement of the fluid is little high. So at least what is recommended is to take 8 glasses of water. That means around 1 to 1.5 liter of fluid. That is the minimum basic requirement for the body. So that they need to take. Yes, of course, if they are suffering from heart disease, then we say that it can be little low, around 1 liter, but between 1 to 1.5 liter is recommended.
So the question that has come in is, Mr. Narendra Shah has asked about the quantity of water the senior citizens must take, and that you've just answered. Doctor, the question that is there is it safe to have the AC on for more than 8 hours a day in the heat?
The idea is to keep the temperature at a desired level. So see, the elderly age group, they are more prone for temperature variation, and their body will not be able to adjust as the young adult do. So keep the AC on for 8 hours or 10 hours. As such, there is no duration, but you can keep it on, but try to maintain the temperature of the AC at the same level.
Maintaining of the temperature at the same level is important. Mr. Narendra Shah's question about the quantity of water has been answered. Doctor, a question that has come in is, in terms of fluids, other than water, there is always a desire to have some flavored water. And what should one have when there is a desire to have flavored water? What about carbonated water, which is either a soda or a soft drink? What is your view about them?
See, carbonated water and coffee and the fluid with high caffeine intake, they are not recommended actually. When we talk about the fluid intake, we are saying about the normal liquid water or the ORS powder. Because this carbonated water, they can actually have what we have in our body is the temperature regulation. Our body regulate temperature. Okay. So if what the main mechanism is, during the heat, we sweat, and because we sweat because body is trying to excrete our heat. It's trying to heat. So our idea is to maintain that by taking normal fluid, not the carbonated, because these carbonated drink or the drink containing high caffeine, they may have adverse effect. So it is advisable to take like coconut water. They can take normal fruits. They can take normal fruit juices, coconut water, as I said, the fruit and the vegetable which has high content, like we have banana, they can take banana. Obviously, they need to think about their illnesses. If they are diabetic, so the limitation are there. So, but still, they can take tomatoes, spinach, cauliflower, all these contents, all these vegetables and the fruit, they have high content of water. So that is recommended.
Doctor, what about cramps? Somebody has asked. In the summer, I get more cramps than I normally get. What should I do?
That is one indication that patient is having heat-related illness. See, there is one entity what we call as heat cramps. So in heat cramps, see what the heat cramp is the indication that your body is not properly hydrated, or there may be some electrolyte imbalance. Like electrolyte imbalance, what we say that sodium may be low or potassium may be low. That is one of the reasons. Like in elderly age group, they are taking a lot of medications also controlling for their blood pressure control. So heat cramps is they are getting painful contraction of the limbs, or it may be in the upper or the lower limb. So that is the indication that the body fluid content, the water content of the body is not adequate. So they need to increase their fluid contact in body by taking in form of ORS and any electrolyte or any fruit juices or coconut water.
And doctor, what about having cold stuff? One wants to have ice creams and all of that. it could also mean that. So the question that is there, which I have just seen just now, which has come, is that for 2 years I did not have ice creams because it was the threat of COVID was there. But now I feel like having ice cream, and I did try having it some time back, and I got a sore throat.
There is no relation actually. They can eat ice cream, but then I said it is actually to keep yourself cold, not by taking cold fluid. It's not reciprocating. You need to keep yourself cold, but it doesn't mean that you need to take cold fluid. Obviously, you can take thinking other things in mind. Like if you have diabetes, that if you eat ice cream and all, that will further increase your blood sugar level, and uncontrolled diabetes or uncontrolled blood sugar, that is also a risk factor for dehydration. So in summers, eat them in a regulated amount, and as such, there is no correlation between the eating ice cream and having the bad throat.
Question somebody has sent me, since you are talking about summer, can you ask doctor about how beneficial or harmful is beer in the summer?
No, see, that's yes, sir. I explain that beer is a kind of a fluid that will cause more of urination. So if you are taking it, it causes more formation of urine. So actually, if you are taking beer, you are at risk of getting dehydrated. Occasional drinking, that's what we call social drinking, is allowed, but not the quantity should not be that much, because that will also prone for them to get dehydrated.
What you are taking, what you think is good for you for the summer, which is a lot of beer, would actually dehydrate you.
Yes, sir.
And is it only beer or all liquids in excess? For instance, if you have Nimu Pani in excess, is that also a problem? Because at the end of the day, or any excessive intake of liquids will cause excessive urination.
Yes. No, but as I said, if you drink more, you'll pass more urine. But if you drink normal amount, normal fluids, that will not be harmful. Like you can take I said coconut water, you can take Nibu water, you can take in adequate amount. You can't just keep on drinking the Nibu water for the whole day. What you can do, you can take 1 or 2 glasses of Nibu water, that will keep you well hydrated during the day.
All right. Thank you, doctor. Doctor, what about skin and skin care in the summer? What are the special areas that one should look at for skin care?
Yes. See, what we advise that during summers, the intensity of ultraviolet rays is little high. So our idea is to get protected from the ultraviolet rays, and that the ultraviolet rays are high during the midday. So if we are going out, so first thing is to wear the loose fitted clothes, not the tight fitted clothes. Use the hat when you are going out. And most importantly, as these patients are elderly age group, they are at risk of having skin cancer also, because the exposure is during they are more than 65-year-old. So exposure or to sun is little longer. So they are at risk of having cancer. And in acute phases, like if we go out and sweat a lot, then they are at risk of having diseases like itching and eczema and rashes. So we recommend use of sunscreens. It's better to use the sunscreens while going out, and wear the full sleeves clothes, not the half sleeves clothes, so that you can protect your skin from getting exposed to the ultraviolet rays.
Doctor, this is a question that is important, which is, Doctor, I live in Mumbai. Every time the summer sets in, we are warned about food poisoning cases increasing. That we need to be very careful about the kind of food we eat and the kind of water we drink. Is there a problem which happens in the summer?
We are more prone to get, one is the quality of food. We need to eat if we are eating food, the food should be hygienic. The other thing, we are more prone to get the gut infection are little more in summer, because we have normal bacteria in our gut system, which are usually silent. But during summer, because of the other factor, because of the heat, and because of the body water going down, they can cause infection. One, that thing. And other thing, if we are not eating hygienic food, that puts us more at having GI infection. Like we can have diarrhea, dysentery, and all those things. We may have vomiting also, and that is a part of dehydration.
Doctor, the thing that you mentioned about heat stroke and sunburn, the question that is there is, what is the difference between a heat stroke, sunburn, and heat rashes?
The heat stroke is the severest. It is the severest form of heat illness. The temperature of the body is not regulated properly because it goes more than over 104 degrees Celsius, and the symptoms are patient may be unconscious. That's why we call it as heat stroke, and the temperature will not be regulated by the medication. The only thing is to keep them, we need to put them under we need to cool down the body. So what we do, we put water over the skin and then put them under the fan. So basically we are trying to cool down the body. So in heat stroke, initially when the heat illness starts, initially we have heat cramps, and which may, if not treated properly, later on we may have heat stroke. Heat stroke, we need to consult the doctor in the hospital because patient may have systemic diseases, systemic illnesses like BP may go down, they may be confused, they may have dizziness, urine output may be low because the severe dehydration is there in the body. That is for heat stroke. And the second, you said that about the skin sunburn. Sunburn is basically the exposure of the body skin to the ultraviolet rays. So we need to protect that, as I said, by wearing proper clothes and using the sunscreen. It is just the system, it is just the reaction over the skin that we have after prolonged exposure to the ultraviolet rays. That can be prevented by proper use of, but also you need to keep yourself dehydrated, because if you go out, our body will sweat more as a normal mechanism, and sweating will cause skin rashes. So that we can, like if any elderly person is going out, we tell them to drink at least 500 ml of water before going out, so that they will not get dehydrated while they are going out in the sun.
A question that is there is being asked is, Doctor, is it advisable to have a bath twice a day, given the fact that it is so hot? And if one can have a bath twice a day, at what time for a senior citizen is it safe to have a bath in the evening just before you sleep? Or
There is
just before you sleep or earlier?
Sorry, sir?
Just before you sleep or earlier in the evening? What is a better time to have a bath?
As such, there is no time frame for taking bath, but having 2 times bath in a day is keep you little more hygienic, and that you can do in the morning and evening.
Bath morning and evening, twice a day. Doctor, we have a question from Mr. Brij Duggal. Is color frequency and quantity of urine any indicator of dehydration?
Yes, normally we pass little yellow urine, but if we are passing little dark colored urine and we are feeling at the same time patient is feeling little thirsty, and that is the indication of decreased quantity of urine and change in the color of urine. That is the indication that patient is getting dehydrated. So at that time we need to take little more fluid to keep the hydration of the body in a proper way.
So, Doctor, we keep hearing about a lot of summer diseases that happen, which is like mumps, chickenpox, measles, typhoid, etc. Now, these may not all impact the senior citizen, but do we need to be careful about these?
Chickenpox and mumps, they are all communicable diseases. So if one person is suffering from chickenpox, they need to isolate themselves so that they will not contract that disease to others. So these are all infectious diseases. So we need to take proper precaution. Yes, of course, they are more common in summers. And the second thing you said, typhoid. Typhoid is because of the poor hygiene. We are not eating proper food. The food is dirty. So the infection is from the gut. The dirty food, the bacteria is going through your mouth, inside your intestine, and then causing the infection. So as I said, these 2 infection diseases, you have to be little more precautious so that you don't spread it to others. And typhoid and all, which is a little more common, because if we eat unhygienic food, that will put us at risk of having typhoid, because it is because of the poor quality of the food. Like we eat from outside, the roadside food, they are more prone they will put us at risk of having typhoid. So that we have to avoid. eat the hygienic food.
Eat the hygienic food. Here's a very interesting question that I've got. It says, doctor, when I was a child, we used to go around, have sugarcane juice uh, and various other juices from the roadside. But now, when I ask my grandson to have sugarcane juice, my son says, "Please do not say that. The sugarcane juice is not healthy." Tell me, what is wrong with sugarcane juice now that it is become unhealthy?
The process, sir, the process by which they are making that juice, that process may not be fully hygienic, because he is putting all the canes in the one machine. So if the machine is like dirty, and see, the one is to extract the juice, and the other thing putting that in the glasses. So these are the point at which we are more prone to contract infection. Like as I said, that typhoid, we may get typhoid from that. So we usually, because it is not about the sugarcane juice, it is about the method used to extract that juice from the sugarcane, this thing.
Absolutely. I think the key factor is on the hygiene levels. And I think it's not just a problem of the summer. It could well happen in winter, wherever you are eating from, whether it's at home or whether it is outside. At home, everybody is very careful about the kind of food that you eat. But when you are out, uh, you are obviously not able to figure what the hygiene levels are. So one needs to be a lot more careful than you normally are. We have a question from an anonymous attendee, 77 years, diabetic, special precautions during ensuing summers in addition to water intake. I think you have answered that question. Doctor, what else is something that we should advise our readers, our people who have gathered here and who are watching it on YouTube, etc.? What are the necessary things that you would recommend any senior citizen to be doing just before the summer is setting in?
As I said, keep the intake of the fluid proper in the body. Take your medication of diabetes, kidney disease, and as they are suffering from cardiac problems also, take the medication properly at time, and try to avoid exposure to the sun, heat, by avoiding going out at the peak hours, and try to restrict your activities. Try to be indoor in the AC rooms or in the cooler rooms, and take adequate amount of the healthy diet. Take lot of the vegetable and the fruit containing high amount of water, as I said. So these are the precautions we have to take.
Thank you, Doctor. I think we've had a very enlightening session. And we have touched upon quite a few areas that are there. As Doctor said, hygiene is important. Of course, water is something that you must consume a fair bit. Liquids is something that you must consume a fair bit. But obviously, depending on how your health condition is, you need to moderate it. You need to temper it as well as you can. And of course, the critical thing is that don't just believe in self-medication or Dr. Google, as we say. Do consult your doctor, your family doctor, your general physician, and ask them what should be done in case you feel very tired and you feel dehydrated or whatever. Doctor, one last question that has come in is at what stage should we approach a doctor when you are feeling a little tired? I feel very funny to call up the doctor and say that I'm feeling tired. What should I do?
No, sir, feeling tired, you mean to say during the summertime, and the patient is in a group of more than 65 years. So if they are feeling tired, that may be related to many things. Maybe related to that they may be having some infections that can cause you feel little tired. And other thing, the first symptom is fatigue, or what we call tiredness, that they are lying down for the whole day, they are not getting up properly. That is the one symptom. That is the first symptom. That is the indication that the fluid in the body, the water quantity in the body is not adequate. So at that time, see your urine, you are passing adequate amount of urine and the color of the urine is okay. You are not feeling too thirsty. If you are feeling too thirsty, that may be related to heat also. And other thing that may also be there is that these patients are taking their BP medication and all those things. So that is also one that may uh, that may cause tiredness if patient body water is little low and may be related to other illnesses also.
Thank you, Doctor. Thank you very much for being here. And thank you for the Spine Center to facilitate this session by you. You have answered quite a few questions. It's a very basic level topic that we had today, but it needed to be discussed. It needed to be discussed because this is what we are. We are seniors today, and we will look at every possible issue that concerns senior citizens. Doctor, we have one more question as we sign out. Is it better to exercise for a lesser duration in the summer?
Try to do only stretching exercising or little exercising during the daytime, but you don't exert yourself too much. That is the message. Try to keep it to very minimum level so that you feel yourself little healthy. So keep your body active by doing little exercises at home, only indoor, not outdoor. That will help, but do not exert yourself too much.
Do not exert yourself too much, and of course, watch your body. Your body tells you. Your body, will tell you how it is feeling, and if you are exerting yourself, if you're feeling dehydrated, etc., do consult your doctor. Thank you very much, Dr. Rajkumar, for being here and for taking all sorts of questions that we've had today. Whenever the question is as simple as this, there are, quite a few questions that have come in. We will be here once again next Saturday, that is March 4th, with another session of Health Live at Seniors Today. We have Dr. Parvez Grant, who is the Chief Cardiologist and Cardiovascular Surgeon and Managing Trustee of the Ruby Hall Hospital, who will be here next week. We are privileged to have him here next Saturday. And for those of you who would continue to who would like to be there at all our Health Live seminars, please pre-register for them. And we are putting up the form in the chat window, the link to the form. Enter the form and you will never miss a session that we have. We will pre-register you and you will get informed about it. Agreed, you may not be able to attend all of them, but it's always good to be informed in advance about when the session happens. There are times when we are not able to fix up with the doctor till very late because these are days when doctors have their OPDs, doctors have their patients. We are really very thankful that Dr. Rajkumar has spent some time with us today. One thing that has happened, and I must ask you this question as of the topic of discussion, but internal medicine specialists have suddenly become so much in demand after COVID, hasn't it? Hasn't that increased?
Yes, sir. The illnesses we are having in our country are more of the infectious diseases and related to our poor hygiene, like what we have commonly: COVID, influenza, pneumonia. You said chickenpox. You said flu and mumps. You said all those. See, these are infectious diseases. So if suppose I am suffering from chickenpox, unless I take proper precaution, if I go out, then I am putting other people at risk of acquiring that chickenpox. And that patient, so it is from one to one. I will spread to others, they will spread to others. So same is with the COVID, like we have seen in COVID time also, and other influenza, like we see in winter. So our pattern of disease is more of communicable and infectious diseases. That's why, and we as a physician, we deal in all these diseases. So these diseases are actually increasing, and post-COVID, the incidence of these diseases is little more. So that is the reason we are little busy.
Little busy and much in demand, I must say, which is why it's doctors like Dr. Rajkumar are much in demand these days, especially in cities like Delhi and Mumbai, where we've had, unfortunately, the incidence of COVID has been huge. The pressure on the medical fraternity has been huge, and we really thank doctors for the immense service that they have given to Indian society. And thank you very much, Dr. Rajkumar, for being here and for spending quality time on a Saturday evening. And to all of you there, we will be back once again next Saturday, that is March 4th at 5 p.m. with our next session of Health Live at Seniors Day. Thank you very much and see you next week.
Subscribe now and press the bell icon. Never miss an update.